I'm Dr. Beverly Vaughn, and I would like to welcome you to Women's Health Source Menopause and You Chat with a Physician. Today's topic is the changes in a woman's skin as they go through menopause. Our guest today is Dr. Lynn Klein, a dermatologist at the Lankenau Medical Center. Welcome, Dr. Klein.
Thank you for inviting me.
I get many questions from my patients. They're concerned about changes in their skin. They weren't expecting all these different changes. Can you give us an idea of what the causes of some of the common changes are?
Certainly, I'd love to. I actually get all of those questions myself. Just when you thought you left acne behind in your teenage years, in your 20s, due to hormonal changes and fluctuations, starting around the 40s, we start to develop skin changes such as breaking out with acne on the lower half of the face instead of the teenage T-zone. Our skin starts to get a little bit thinner. It starts to dry out. And unfortunately, some women start to develop some facial hair as well. These are all concerns of my patients.
Do you notice any changes in different ethnicities, or does everybody's skin age in the same manner?
Certain ethnicities do have a higher tendency to have excessive hair growth, and it does run in some families. But basically, all skin colors can experience excessive hair growth, acne on the face, and thinning of the skin.
What about the sun? We're told that we always need to protect our skin from sun damage. Is your skin more sensitive as you age to sun effects or less sensitive?
Some women experience some increased pigmentation on their face called melasma, which is mottled pigmentation on their cheeks, sometimes their upper lips, their forehead, and they're extremely bothered by that. It wouldn't happen if they were not experiencing some of the hormonal changes in conjunction with going out into the sun. Everybody is exposed to it, whether male or female, to the effects of the sun, and we are experiencing more photo damage due to all the holes in the ozone layer and depletion of the ozone layer.
Let's talk about, for our audience, some of the things that they can do to aid their skin, some of the very common daily skin care that they can perform.
I always tell my patients the most important anti-aging cream, antioxidant that they could possibly use on a daily basis, no matter what the weather, no matter what color their skin, is a broad spectrum sunscreen. And just waking up every morning and putting either a moisturizer with a sunscreen or a sunscreen on their face will prevent many of the changes that we experience with photoaging.
You hear a lot about ceramides and over-the-counter retinol products. Do you find that those are helpful and protective for patients who are aging?
Definitely. Patients do need to repair their epidermis, and I love moisturizers that contain ceramides. I also like them to use a moisturizer with a broad-spectrum sunscreen. And any of the retinoids, whether they're prescription or over-the-counter, which are derivatives of vitamin A, definitely slow down photoaging and repair the epidermis by stimulating new collagen growth.
Is there a different skin regimen that you recommend people do in the morning versus what they would do before they go to bed?
Yes, I love for them to use the retinoids in the evening very sparingly. If they need to add a moisturizer, I have no problem adding it right over that. And I prefer the moisturizers to be applied in the morning.
In terms of the acne and the hair growth, what kinds of over-the-counter products would be helpful?
There are many over-the-counter cleansers that someone can use, but they tend to be more irritating for mature skin because they contain salicylic acids or benzoyl peroxides. So we have better prescription cleansers and effective prescription medications for adult hormonal acne than we do over-the-counter.
As a dermatologist, what can you offer to patients in terms of helping them with their acne, helping them with their hair growth that they're so frustrated with?
It all depends upon the severity of the acne and the excessive hair growth. We can offer them oral antibiotics, hormonal therapy. Sometimes the low-dose oral contraceptive pills will help their adult hormonal acne, as well as spironolactone, which is another prescription medication. There are many topical medications, for example, metronidazole, and medications that contain azelaic acid. For the excessive hair growth, I always tell my patients you can go from the least expensive to the most expensive, from over-the-counter using depilatory creams, plucking, waxing, shaving, or laser hair reduction is extremely effective and a godsend for many of my patients. Fortunately, today we have wonderful technology with laser hair reduction that can treat facial hair in all skin colors, and it's extremely effective.
I think that our audience is going to be so pleased to know that there are a multitude of options for treating their skin problems. So, Dr. Klein, thank you so much for giving us your great wealth of knowledge today.
Thank you for having me.
Thank you for joining us for today's Menopause and You Chat with a Physician with our guest, Dr. Lynn Klein.